Hi, this is Vincent Shkreli from the Daily Caller News Foundation. I'm here with Congressman Denver Riggleman. He's going to discuss with us the Heroes Act of 2020. How are you, Denver?
Good. How you doing today, buddy?
I'm doing well. Can you explain to us what this act entails, the specifics?
Yeah, sure. The Heroes Act is really based on combat pay and tax incentive for those in a combat zone like I used to be when I was, in the military. So what we do is give a tax holiday to first responders, nurses, nurse practitioners, ambulance drivers, anything you can imagine, people that are involved in the pandemic treatment in in the counties that have COVID in them. So it's really every single county that has COVID. Every single practitioner in there has something to do with the health industry, whether they're treating people or helping people. They get a tax holiday for 4 months from 15 February to 15 June.
And when do you think this is going to be implemented?
Well, I tell you what, I want to get this act passed, right? And Bill Hazinga from Michigan, my good friend, called me. I think I was one of the first ones on this as an original co-sponsor, and I think it's something we need to pass immediately. It's just like the payroll tax cut. If we put more money in people's hands, that's what we want to do. But these individuals might not be getting raises. They're working incredibly long hours. I'm talking about first responders and healthcare workers, and we got to help them out. So as soon as this law is passed, it would go into effect. We need more Democratic Party co-sponsors. We have a few, but we need a lot more. And so hopefully we can pass this law quicker rather than later. And I don't know. I just hope that more Democrats jump onto this bill. And by the way, there are provisions to extend this bill past 15 June if the pandemic goes longer as far as the state of emergencies in each of these states and each of these counties.
You don't think it would probably be vetoed by any chance for dealing with any specific matters?
I don't think so at all. I mean, if it got to the president's desk, he's going to sign it. I mean, it really, we have frontline responders that every day are putting themselves in harm's way. And it's just sad to me. I have a personal story about this, Vincent. My brother is in the critical care pool. He's a critical care nurse in Northern Virginia. So he's bouncing around between areas like Fairfax, Loudoun County, up into Northern Virginia that really it's not doing so well when it comes to COVID-19. And I get the calls from him every day. So I sent him 4 N95 masks because, I own a distillery. So we sent him 4 N95 masks just to make sure he had enough PPE to get through his days. So this is something near and dear to my heart. It affected me when I was in combat to have these tax incentives for my family also. And I think it's going to help those on the front line fighting this COVID pandemic. And I just believe we need to do it sooner rather than later.
And the differences between this and the Heroes Fund, which has been proposed by the Democrats, can you explain the differentiation?
Yeah, the fund is, I believe, from what I've heard, is going to be money that's put into a fund for these individuals to tap. So this is a little bit different. This is the ability to actually have your taxes written off or not to pay taxes on your income during the time you're fighting COVID in those counties. And I can give you sort of an example. About 97% of the counties and county-like equivalents, which are cities or municipalities in Virginia, have COVID-19. So anybody in these counties are going to be covered by this. Now, people coming outside of a county, say they're in a county that doesn't have COVID and they're treating people in a COVID county, they would be covered too. So it's a little bit different. It's that people get to actually write off taxes, not a fund that's separate that could go to first responders, but this allows them to keep more of their money immediately, as they go forward. So that's what I'm hoping that we can get through. And so, besides the Heroes Act, I came up with a strategy called Survive and Thrive. So you have bills that help us survive now, like the Heroes Act. Then you have those bridge bills, like I put in a bill, the Opportunity Zone Extension Act, which allows investors to have those advantages of investing in opportunity zones beyond 2026 all the way to 2030. So that's the bridge from survive to thrive. And those are the type of bills I'm putting in, and also things like the hemp opportunity zone legislation I'm looking at right now in rural areas in Virginia. That's the thrive part of this after we do this. So all of our bills are in two sections. They're survive and thrive. You survived during the pandemic doing the bills for surviving. Then you have the bills where you're looking into the future. And it's really based on my mission planning experience, right? You have the problem in front of you and the problem you're trying to expect, or the problem you're trying to solve in the future. So pretty excited. My staff has been awesome as we've done the survive and thrive sort of policy that we have in my office right now.
The template of the bill is basically structured off the military aid for tax.
It is. It is. It's just like, for instance, when I would say, I don't know, go into Oman, or when I was in the Middle East, during certain things, or when you go into areas that you're in harm's way, you get that tax incentive, right? And that tax incentive is you're not paying taxes in a combat zone. Right now, we're fighting an invisible enemy, and these frontline and first line responders, they're in a combat zone right now. So they should be treated as such. And I hope we get this bill through, and I hope we get more Democrats on. And I got to thank again Bill Huizenga from Michigan. He had a great idea. He called me. He knew my background in combat, and I just thought this was the right way to go. And I immediately said, Bill, count me in. Let's do this.
That's awesome. Thank you so much for joining us, Denver.
Vincent, thank you very much. And I want to thank everybody out there who's taking care of all these individuals. Vincent, I went into a COVID lab, testing lab, but then they took me to the COVID tower at the University of Virginia Hospital, and I got to see COVID patients firsthand, and it is not a good thing. And so these people are putting their lives on the line every day, trying to help us. And again, I want to thank every first line responder, frontline responder, every nurse practitioner, doctor, ambulance driver, testing lab. I'm sure I missed some out there, buddy, but EMTs, I want to thank them all for what they're doing during this pandemic, and much love. And again, everybody here prays for them every day.
All right. Thank you, Denver. Appreciate you coming on.
Thank you, Vincent. You take care, sir. You have a great day.